All right, so in the wake of the health care bill's passage, Senator John McCain announced that he is done working with the Democrats, saying, quote, there will be no cooperation for the rest of the year. They have poisoned the well in what they have done and how they have done it. Well, not only that, but on the Senate floor yesterday, he vowed to do everything in his power to repeal the bill.
We'll challenge this in the courts. We will challenge this in the towns. We will challenge this in the cities. We will challenge this in the farms. We will challenge this all over America, and the will of the people will be heard. And the will of the people is they do not like this process, they do not like this product, and we will prevail over time.
And joining me right now is Arizona Senator John McCain. Senator, good to see you while I'm in D.C.
Good to see you.
How are you?
Nice to have you in the city of Satan.
I was calling it the city of bribery, but I guess it fits. That's a very powerful statement. There will be no cooperation for you from the rest of the year.
Look, let me just clarify that. If it's in the national interest and there's something that requires us to work together, a national emergency, something that we think will help the country, sure. But what I meant was for us to sit down together and say, gee, how can we get something accomplished? Look, we'll just wait until after the election. If it's in the national interest, we will work with anybody. But the fact is that no longer should we, because this process, they have basically shut us out of what is the institution of the Senate, in that it should be 60 votes majority.
It doesn't seem to be working, though, with the American people. I cited these polls with Newt Gingrich. Harry Reid has an 8% favorable rating. Nancy Pelosi, 11%. Congress, 64% disapprove of Congress. So clearly, people in this country have picked up the process is corrupt and tainted.
Yeah, yes, absolutely. I mean, how else could you leave out tort reform, and how could you include these special sweetheart deals that basically buy votes? But, you know, Sean, one thing is, you mentioned being here in Washington. On Saturday, I was in Arizona. I had 2 town hall meetings, one up in Prescott, one in the East Valley of Phoenix. And the anger and the outrage, people driving by saying, don't let us take our health care. And then you come back here to our nation's capital, there's celebration, they're having champagne toasts, and the disconnect between the American citizen and Washington, D.C. and the Democrats and this president is the most stark contrast I have seen in the years I've been able to serve.
There's a great piece on National Review Online that Obamacare is not inevitable. I've been quoting the last couple of days Senator Ken Conrad. He says it's not a slam dunk that the changes, the fixes, the reconciliation can make it through the U.S. Senate where you are. Can you explain to people that are starting to get confused now the president signed it into law, the fixes go back to the Senate? Do you think it could be stopped?
I don't believe so, because the way that the fix is in, instead of having a House bill go back to the Senate where they know they would not get passage because of Scott Brown's election and 41 votes, they're doing this, quote, reconciliation, which was never intended to affect 1/6 of our gross national product. So they only need 51 votes to prevail, rather than the 60-vote tradition of the Senate. And I'm telling you, it is just... It is an outrage what
you were saying then to the American people. The only way to stop this, if I'm interpreting what you're saying correctly, is to defeat the Democrats in November and then the president, make him a one-term president. That's the only way you see out of this?
I think we can go to court. I think that there are real constitutional challenges. I think we can put pressure on. We can make it clear that that people who voted in favor of this legislation, that their time is limited. But yes, then the people will decide next November. And we Republicans have to continue to point out that it's not a choice between Obamacare and nothing. We had many proposals to really bring down costs, to really fix a broken system that costs are out of control, but not take over, have a government take over the healthcare system. Do you know there's going to be thousands of new IRS employees?
16,000.
16,000?
We're actually creating a few jobs there, Senator, for the first time.
16,000 new IRS agents are going to be out and about for checking on small businesses.
I watched closely the exchange that you had at that summit with the president, and you raised the issue of process. You raised the buy-offs, I call them bribes. You know, if you're going to use taxpayer money to buy a particular senator's vote, the Cornhusker kickback, Louisiana Purchase, exemptions for states like Florida and some other places. You tried to raise this. He dismissed you. The election's over, John, I think is what he said.
Campaign's over. And, of course, I had to, and it was appropriate to laugh. But it's also a point that needs to be made that the campaign may be over, but the commitments that we make during a campaign are not over, particularly when you say 8 times that there's going to be C-SPAN cameras in the room so that people will know who's on the side.
He broke another promise today. He told the American people during the campaign they would have 5 days online to read the bill, and he signed this thing in, 36 hours after the vote on Sunday. Earmarks, lobbyists, unemployment won't go above 8%. A lot of broken promises here. Do you think he's gotten a pass from the media? Do you think he's gotten... You didn't think the media coverage was fair in the campaign. I know that for sure.
Well, I've never complained and never will, but I really am interested in the celebration almost by some of the liberal media at the outcome of the vote. It was fascinating. But again, I want to point out, one was the sweetheart deals buying the votes, the 60th vote, the ones you mentioned. But there was also the deals for pharma, for the American Medical Association, for the Hospital Association, for all. So there was really 2 sets of bribes going on at the same time. I mean, I've never seen anything like it.
And we're bankrupt in the country in the process. And we're going to destroy the best healthcare system in the process. Look, this is not overheated rhetoric. This is reality. And unfortunately, we won't see this for years to come, which is my greatest fear. People will become dependent. They'll have their power. And by the time they realize what has happened, I think in many ways we risk it being too late if it's not overturned immediately. So
let me just point out one other thing real quick. Congressional Budget Office. We all trust the Congressional Budget Office, but it's garbage in and garbage out. If you give the Congressional Budget Office certain assumptions, they will reach certain conclusions. The doc fix, the doctor's reimbursement payment, we all know is due to be cut 21%, which means if we did that, doctors would stop seeing Medicare patients, okay? Everybody knows that's going to be fixed, okay? Yeah. But they counted it in whether we would have a deficit or not.
I love how you pay taxes for 10 years and you get 6 years of, quote, benefits. Senator, good to see you. Thanks for stopping by. We appreciate it while we're in.
Sean.
What do you call it again?
Trying to do the Lord's work in the city of Satan.
City of Satan. All right. Senator, appreciate it. And coming up, he has been accused of calling Congressman Bart Stupak a baby killer. But tonight, in a Hannity exclusive, Congressman Randy Nagebauer sets the record straight about what really happened on the House floor on Sunday night. And don't forget, by the way, it is Text Vote Tuesday. We want to know if you're happy with the government health care bill that passed. You can text us at 36288. H1 for yes, H2 for no, H3 if you're not sure. And by the way, I got my text right here, and I'll be texting myself. We have the results later in the program. Straight ahead.